Okay, chapter 7 is about the respiratory system, and you guys should study these terms, the word roots, prefix and suffix yourself. So I will start from here. Ventilation is the movement of the air, so that is between outside environment and the lungs. If the air goes inside the lungs, that is called inhalation, and that carries fresh oxygen. And when you breathe out, that is exhalation or expiration, so that's another name for it. And that is where the air is leaving the lungs, and that air contains a higher level of carbon dioxide and lower level of oxygen. Inhalation is also called inspiration, so that's another name for it. So ventilation in general is that movement of air through the respiratory tract. It's not talking about exchange of oxygen or carbon dioxide. When we talk about the exchange of the oxygen and carbon dioxide, then is the respiration. So there's two of them. One is external one, and that is exchange of oxygen and carbon dioxide in the lungs. So oxygen is from the air, it goes through the lung epithelial tissue, and then it goes to the blood, and carbon dioxide is leaving the blood and it goes to the air. So that is the external respiration, so at the lungs. Then is the internal respiration, that oxygen that was entered in the blood, so that is attached to the red blood cells, and the red blood cells carry oxygen to the tissue, and then the oxygen is delivered in the tissue, so the body is using that. And there is also carbon dioxide is made from the metabolism. The carbon dioxide is picked up and that goes back to the lungs. So that area that in the tissue, the local area in the tissue that exchange of oxygen and carbon dioxide happens, that is the internal respiration. So there's depends on the location, that has two different names. The anatomy of the respiratory tract, so we start from the nose. So these are the nares, so these are the openings in the nose. Air enters the nasal cavity. You can see the nasal cavity. These things that you see, these are a bony prominence and is covered by the epithelial tissue. They are called conchae or turbinae. In this area, there is nerves there, and that's for sense of smell. These bony projections or turbinae increasing the turbulence of the air that is you're breathing in, so increasing the pressure, and that goes to the deeper part of the lungs. So this is one reason. The other reason, it has mucus, and the mucus is picking up all the foreign particles, and also there is highly vascularized, so that is good for making the air warmer. And also it has some hair, so in this area some hair grown, and that's again is to pick up foreign particles. At the back of the nasal cavity, so this is the area that the pharynx starts. Pharynx has three different parts, so the upper part is called nasopharynx, and you can see the back of it. This is lymphoid tissue. This is just for defense against any kind of infections. Then the air goes to the oral cavity, and this is the soft palate, so that's behind in the throat area. And you can see the tonsils. So tonsils are mainly for food. You have the two different lymphatic tissue here, but again it can be used also for the respiratory infections. And then it goes to the larynx area, so this is still pharynx, but it's in posterior to the larynx. This is larynx, so this is called laryngopharynx. It goes there. From there it enters the respiratory tract, because pharynx is shared between the respiratory and the digestive tracts. continuation of the pharynx, you will have esophagus, and when we get to chapter 8 I will discuss that. But respiratory tract, so this is the start of it if you are not considering the nose. So the nose is the upper part, but then this is after the pharynx, this is the larynx. It is made of different cartilages. That is the epiglottis. When you swallow something, the larynx goes up and epiglottis comes down and blocks this area, so no food can enter. And if a food enters here, then you cough. It is a big chunk of food, then the person chokes. Okay. This is the vocal cords, and this is where this vibrates, so it creates sound. You can see the cartilages here. There's the thyroid cartilage, this is the epiglottis, and this is the cricoid cartilage. It's like a ring. The thyroid cartilage is also the Adam's apple, so if you touch your neck in the midline, you may feel a prominent area, and that is the thyroid cartilage, and that's located below the hyoid bone. Below the larynx you have the trachea. So trachea is made of multiple rings. These rings are made of cartilage. The posterior part of the ring is open, and that's made by smooth muscle. So this smooth muscle can contract or relax, and that will change the diameter of the trachea. So the amount of air is you needed changes by that. The trachea is anterior to esophagus. Okay, they are located in the the lower part of the neck, and also in the upper part of the chest. You can also see the thyroid gland, so it's located in the first few tracheal rings. And again you can see the trachea here. So and the thyroid gland should be around here. This is the thymus. In adults, the thymus usually regresses, so you do not see that much small part. Once it's inside the chest, the trachea divides, okay, and that becomes a bronchus. So the rest of it you cannot see it in this image. It's inside the lungs, so it's really difficult to see it here in this image. But let's talk about the lungs here. So there's two of them. The right one is bigger than the left one, because the left one, the heart is pushing it, so the heart is in the midline, but it's toward the left. So a big part of the heart is on the left side. That's why the lungs on the left side is smaller. Also, the lung has made of lobes. The right one has 3 lobes, the upper, middle, and inferior. The left one has 2 lobes. This is the superior and the inferior, or upper and lower. And also it has a tip. The tip is located posteriorly, and this is the base that is located inferiorly. The base is above the diaphragm here. And this is the branches of the bronchi. So this is the trachea again. These are the bronchi. This is up to here, around this area. It is outside of the lungs. So these are the main bronchi, or primary bronchi, so one on each side. Then is this area that enters the lungs, so this area is inside the lungs, and that changes again, becomes smaller, and that becomes secondary bronchus or lobar bronchus. Okay, then they become again, so secondary is going to each lobe. Okay, then it's becoming smaller, and that becomes segmental, and then smaller and smaller and smaller, become very small. Finally it become bronchioles. Okay, bronchioles are really small ones. So at the end the bronchioles will not have any cartilage, and then it changes to respiratory bronchiole. The respiratory bronchiole is that contains these bubble-shaped structures, and these are called alveoli. So this is where the oxygenation takes place. So these all like grapes, you can see it, and this is called alveoli or air sacs. And the alveoli are made of these epithelial tissues, so it's a one layer of epithelial tissue, but also it has these elastic fibers that keeps it open, and it is wrapped by a lot of capillaries, and this is where gas exchange takes place. Oxygen enters and the carbon dioxide leaves. The alveoli together with capillary, this is called respiratory membrane. So remember this. Capillaries with alveoli together, that makes the respiratory membrane. This is the physiology of the lungs. So normally when you breathe in and out, it's around 500 milliliter of air enters, and that is spontaneous. That's called tidal volume. The lung has the capacity to take more air, so if you take a deep breath, more air enters there, and that's called inspiratory reserve volume. If you consider tidal volume with inspiratory reserve volume together, that makes it inspiratory capacity. So capacity is more than one volume. Also, you can breathe out a little bit of air from your lungs. So normally at rest, some air is there in the lungs. You can remove it, and that's called expiratory reserve volume. But there is also some other air that you cannot remove. It's always there in the lungs. That's called residual volume. So expiratory reserve volume with residual volume together, that makes it functional residual capacity. So if you ask somebody to take a deep breath in and breathe out, totally breathe in with all the way oxygen full, the lungs become full of oxygen, and breathe out, removing all the oxygens you can. That's called vital capacity. Is really important for evaluation of respiratory patients, but the residual volume you cannot remove, it's still there. So if you add vital capacity with residual volume together, that makes total lung capacity. It means that if you take a deep breath, all the amount of air that's in the lungs, that will be the total lung capacity. Some signs and symptoms: anoxia, an means without, so that is unable to get oxygen from inhaled air. Asphyxia, there is oxygen in the air, but there is a blockage in the airways that the person cannot get it. For example, choking or hanging a person, and that will cause unconsciousness, and the person dies right away if there is not enough oxygen. Hypoxemia is not enough oxygen in the blood, and that can be a problem with the lungs, or it can be in the airways, or it can be in the blood. So different reasons. And hypoxia is a problem with lack of oxygen in the tissue. So the lungs are okay, but maybe there is a blood vessel is a problem, not enough flow in the area, or maybe the tissue damage, and this is causing hypoxia. And hypercapnia means too much of carbon dioxide. Carbon dioxide are actually important because that stimulates the respiratory center in the brain, and this is how you breathe without thinking about it. But if you have too much of the carbon dioxide, that's a bad thing because it makes the blood acidic, and it will cause problems with the enzymes and other problems. Eupnea is that the person is breathing normally, so the rate of respiratory normally is between 14 and 20, so that is normal in an adult, that a person is not breathing too deeply or too shallowly. That is eupnea. And apnea, that the person is not breathing at all, so that is maybe not signals are sent, totally the person is in coma or something, the person is not breathing. It could be different reasons. Bradypnea, brady means slow, so the person is respiratory rate is below 14. And tachypnea, it means that the breathing is fast, so it's above 20. And both of these things can mean different things. For example, bradypnea, for example, somebody has been taking morphine or heroin, so any opioids can cause that. And tachypnea can be different reasons. if the person has pneumonia, for example, lack of oxygen for any reason, or exercising in normal situations, you can have a rapid respiratory rate. Hyperapnea, it means the person is breathing deeply, and again it can be normal, for example, during exercise, or also the person may have a lot of carbon dioxide. You may have hyperapnea, the body tries to get rid of it. And hypopnea is the person is shallowly breathing, and in this case, for example, somebody has a pain or fracture of the ribs, and they cannot breathe deeply, because if they breathe deeply it will cause pain, and that will cause the person to breathe shallowly. And breathing shallowly is bad because not enough oxygen goes in the airways, and there will be carbon dioxide in the airways, and the person will get hypoxemia. So that's the bad side effect of hypopnea. Hyperventilation, the person is breathing fast and also deep, and this is usually an acidosis. So if the pH of the blood goes down, the body wants to get rid of extra carbon dioxide, and that's what will happen. Also in the panic situation, sometimes people are hyperventilating. Hypoventilation is that the person is breathing slowly and shallowly, so it can be combination of multiple things together, or maybe it could be a nervous tissue, like a breathing center problem, and the person is breathing shallowly and also slowly. Dyspnea, the P is usually not pronounced, or shortness of breath, is the person has a difficulty breathing. It's not pain, it's because of the stretch receptors in the lungs are activated, and the person is trying to breathe harder because of lack of oxygen, or there's problem with the airway obstruction, or maybe fluid is in the lungs. So that could be different reasons, and it's a very important symptom of the respiratory diseases. Orthopnea is like you can put it as a sub symptom of dyspnea, and similar to dyspnea, but the thing is the person in this case cannot lie flat. The person has to sit and breathe. Why? Because these people usually have a heart problem, and when they lie flat, there is too much fluid that is coming from their lower extremity, and the veins fill up and goes to the heart. Heart cannot pump properly, and this is too much fluid is accumulating in the lungs and filling up the alveoli, and they cannot breathe properly, so they have to sit. So it's a sign of heart disease, or a symptom of heart disease. Epistaxis means the nosebleed. Could be from many different reasons. It could be from trauma, it can be from cancer, from very dry air, and it could be from bleeding disorders. One of the common cause of epistaxis is when a child is picking his nose, that could be a reason for that. Polyps is another reason, so there could be different reasons. And I put hemoptysis close to the epistaxis because hemoptysis is blood coming from the airways, so it can cough up just the blood, or it can be with the sputum together, and this is always a bad sign. It could be from trauma, or it could be from cancer, so not a good sign at all. A sputum or phlegm is a mucus that's secreted, but it's too much mucus there. Okay, so normally you need mucus because it's again another defense mechanism in the airways to clear up all the air from the particles and infections. So they attach to that, and the body is trying to clear it up, and it's going from the deeper part of the airways to toward the throat and pharynx, but if it is too much of it, then the person cannot breathe properly. Cyanosis means that there is not enough oxygen and the skin becomes bluish. It can be a sign of the heart disease, could be a sign of the lungs disease, but it can also be um, a vascular problem, so a local blockage of a blood vessel. It could be um, cold weather, so that person becomes cyanotic. The blood vessels and the skin um, vasoconstrict, and the person gets cyanosis. Okay, so there can be some benign conditions, or it could be some bad conditions like heart disease and lung disease. And especially if the lips are cyanotic, that's not a good sign. Okay, so that's always means that there is a person has a breathing problem, or it could be a heart problem. Thoracalgia, it means the person has chest pain. This is not the same as angina pectoris. If you remember from chapter 5, angina pectoris is chest pain with activity. When you stop activity, the chest pain goes down. But thoracalgia is related to pain from many other causes. For example, it could be musculoskeletal. If you're moving your arm, or maybe moving your chest a little bit, may cause pain, or different position, it will cause that, or even respiratory disease or a nerve damage could cause thoracalgia. So it's many different reasons. And pleurodenia is more related to lung diseases. Here the pleura, that is a layer that covers the lungs, is between the lungs and the chest wall, that's inflamed and the person gets chest pain. And the chest pain is characteristic because every time the person breathes, the pain is there. So when the person stops breathing, the pain goes down. Crackle is rails. There's a sounds when there is a fluid in the alveoli. So that could be a sign of pneumonia. It could be a sign of heart disease. And when the person breathes in, there is those bubbles pops up and makes a sound. But you have to listen to it with a stethoscope. Wheeze is the narrowing of the smaller airways. For example, somebody has bronchitis or asthma, they can have a wheeze, so narrowing of the airways due to inflammation or too much mucus. Ronca is another sound. This is also during expiration, and these are the bigger airways that are involved, bigger airways. So compared with wheeze, that is also during expiration, and that is smaller airways. Stridor is during inspiration, and that is usually an obstruction of upper airways, for example trachea. So that is more an emergency situation. For example, a foreign body went into the airways. And pleural rub is that when the two pleural layers are inflamed, and when you breathe in, they're rubbing against each other, and that's creating a sound, and you can listen with a stethoscope. So that's a good sign. And if you ask the patient, stop breathing for a second, there's no sound there, and once the person starts breathing, then the sound comes back. So it's a good way to know that. Aspiration means different things. One is that withdrawing fluid, the other one is that the fluid enters the airways. For example, somebody's drunk and the person goes to sleep, and the fluid from their stomach, from that person's stomach, can go to the airways, and that can cause pneumonia. So there's different ways that aspiration can happen. Clubbing is the distension of the distal part of the digits or fingers. It looks like a spoon, and this is usually from chronic lung disease or heart disease, lack of oxygenation, and there is some growth factors that are released from platelets that cause that. Laryngoplegia is paralysis of the muscles that cause larynx to move. So if the person has laryngoplegia, then they will have breathing problem, breathing also, but more phonation or speaking problem. Rhinorrhea is the blood is coming from the nose, similar to epistaxis, so the name is the same. Rhinorrhea is a discharge coming. The discharge can have any color. It can be clear, and that can be an allergy or a viral infection. It can be yellowish, and that could be a bacterial infection. Greenish can be bacterial infection, and red will be blood. So they're different ones. And here are some diseases. One is called croup, and this is common in children. So acute tracheobronchitis, and the person will have a barking cough, usually a dry cough, and that is the characteristics of the disease. It's a viral infection usually. And diphtheria is a bacterial infection, and swelling of the throat. So when you open the throat, you can see a gray membrane on the throat, and if it's not treated, it can block the airways and can kill a person. But nowadays diphtheria is low because of vaccination, so vaccines are good. Pertussis is another bacterial infection of the airways, and is again in children, and the person breathes, the person coughs maybe 20 to 30 times back to back, and become cyanotic a little bit because of lack of oxygen, and then the person breathes in, and when the person breathes in, that makes a sound, and that's called whooping. So the cough associated with that sound, that's whooping cough or pertussis. And cases are decreased again because of vaccination. Nasopharyngitis, inflammation of the nose and pharynx. So it's a common cold, everybody gets that, and the person may have sore throat and runny nose. It's a viral infection. You can get a partial immunity for a week. And pharyngitis is a sore throat, and that can be from different reasons. It can be a viral infection. Viral infection, usually if you open your mouth and you see the back of your throat is the area is red. If it is a bacterial infection, usually the back of the throat is yellowish, so that's not a good thing. If you have high fever with yellow membrane on the back of your throat and the tonsils, go to the doctor, so they give you antibiotics. Or it could be some allergies from something that you ate, so it could be different things. Something that you ate caused irritation of the airways, and that can cause pharyngitis, so it can be different reasons. Asthma is that is a very common disease. It can happen in children or adults. In children, that's called extrinsic asthma, usually an allergic. It's a type of airway sensitivity and to some allergens. The person will have shortness of breath and coughing and chest tightness and wheezing. For adults, it's different. It is not from allergies to a specific allergen, but it's more from damage of the airways from some fumes. If they're working in a factories, or if you're using different chemicals that they're breathing at work, for example, then they get asthma. So the mucus become very thick in asthma, and that's why they have shortness of breath and coughing. Sometimes people come with just coughing, and that can be also asthma. Chronic obstructive pulmonary disease, or COPD, there's two types of them. One is called chronic bronchitis, and the other one is called emphysema. So the person will have shortness of breath, and they cough, and they have mucus, and that is mainly from smoking. So smoking is really bad. Cystic fibrosis is a genetic disease, and usually chloride channels are mutated, and mucus is very thick. It can cause congestion of the lungs, so shortness of breath is there. Infection grows in the lungs, but can also involve liver, pancreas, and testes. Atelectasis is the collapse of part of the lung because of the some kind of blockage. So the blockage can be from fluid in the pleural cavity, or it could be a block of the airways. So either of those two conditions, from inside the lung or from outside of the lung, it can cause collapse of the part of the lungs. And sleep apnea, it means that the person is not breathing during the sleep. It can be from severe obesity. If the neck circumference is more than 47 centimeter, that can cause that, or it could be some diseases of the respiratory center in the brain that can also cause sleep apnea. So if somebody is snoring a lot, they may have sleep apnea. And maybe listening to this lecture, maybe you're snoring too, I don't know. Okay, so bronchiectasis is the enlargement of the bronchial wall, and that's usually from the infections, and they create a lot of mucus. And usually the characteristics is that in the morning they make a lot of mucus, and if you collect the mucus, it has 3 different layers. So that is a characteristic of bronchiectasis. Anthracosis is a type of pneumoconiosis. So pneumo, if you know, it means air or lung. So conio is dust, and there's 3 different types here, and you see that in the minors. So anthracosis in the coal miners, and they have shortness of breath. They don't have cough, but they have shortness of breath, decreased oxygenation. Unfortunately, there is no treatment for it. So working in the lungs, in the coal mines, are not a good job, unfortunately, because you do not have any treatment for it. Asbestosis is another type of pneumoconiosis. That's too much asbestos in the lungs. It can cause cancer, and also another type is cause shortness of breath. Okay. And silicosis, again in the mines. So silica accumulates in the lungs, and that can cause damage again. It's unfortunate that these people have to work in these mines, and that may cause this kind of different diseases. And it's always, I've read it, that there is always problem with compensation from these mining companies. They don't want to compensate their workers. Pneumonia is an infection of the lung. Okay, so it can be viral pneumonia, and that could be, most of the time you are not that sick, you can even walk. You have low-grade fever, and maybe have some cough and shortness of breath. The bacterial one is much more serious. You have high fever, severe chest pain, and shortness of breath and coughing. And you have a fungal one also that is more chronic. Coronavirus can also cause pneumonia, but it's a viral infection. But there's other issues that nobody knows very well with it, and that is a severe immune reaction, and also there is a cardiovascular component to it. So it's not just a simple viral infection. Influenza is a viral infection of the respiratory system, and happens in the 2 ends of life, so at the young age and also at the older age. That can actually kill a person also, so vaccination is highly recommended. Unfortunately, most people somehow they think vaccination is bad, so they don't want to do it. If it is done properly, I think vaccination is really good. Okay. And tuberculosis. Okay, so that's a bacterial infection, and that is not as common in North America and in Western countries. This is much more common in third world countries because of overpopulation and living in crowded spaces. If you are exposed to it for a longer period of time, living with somebody that is in a closed space, then it's more likely that you will get tuberculosis. So the person has low-grade fever and cough, and they may have bleeding from respiratory tract, and they may have nighttime sweat. And there is other types of tuberculosis that may get in their spine. They may get in their gastrointestinal system and their urinary tract. So there's different ways, but the one that is common in North America is the respiratory one. And histoplasmosis is a type of fungal infection. The person has shortness of breath, and usually it's a chronic condition. Adult respiratory distress syndrome is a respiratory failure. The person has shortness of breath, and that's why they are breathing a lot, breathing fast, and because of the shortness of breath and lack of oxygenation, they get cyanosis, and the level of oxygen decrease in their blood, and they get hypoxemia. Infant respiratory distress syndrome is that if the infant is premature and they are born, then they have rapid respiratory rate, and they have low level of oxygen. Usually, if a mother has labor contractions, and that's not the time of labor, they are still a few weeks left, they can give corticosteroids for 3 days, and that will usually help the child's lungs to have a better opening. When they are born, the lungs can open, the alveoli in the lungs can open better, and they will not have a severe respiratory distress. So that's the best treatment for them. But otherwise, once the baby is born, you can give them oxygen. SARS is I don't think you guys remember it. It was a few years ago, and similar to coronavirus. So same type of viral infection, and RNA virus. That had a high mortality rate among young adults, young healthy adults. It's not the same as COVID is more in older people, but this one was in younger, and mortality rate was high. And these people were dying from their pneumonia. Pulmonary edema is fluid accumulates in the lungs, and that is mainly because of heart disease. Okay, not lung disease, heart disease. There's a backup of fluid that happens because heart and lungs are connected together, and I explained that in chapter 5. So if the person has heart failure and the heart cannot pump properly, and everything backs up in the lungs, and the fluid goes in the alveoli, and then gas exchange cannot take place, and the person has severe shortness of breath. And pulmonary embolism is that if somebody is not moving that much, for example, somebody had had a cancer, they don't move, or they had a fracture of the lower legs, they had heart failure, that they are not moving that much, or they have been traveling for a long time, so for 15 hours or so, then the clot can form, or they may have some clotting factor disease. The clot forms in the lower leg veins, and that goes into lungs, and that can obstruct pulmonary arteries, and that can cause infarction, and the person will have severe shortness of breath. Can kill a person if it is big enough. So diseases of the pleura. So again, if you guys remember, this is the lung, and this is 2 layers. So one is layer attached to the lung, the other one is attached to the chest wall. So there's 2 layers, and there's a small amount of fluid there because the lungs are moving, so this will reduce any friction. So pleuritis or pleurisy is inflammation of the pleura, and they have chest pain every time they breathe. Very, very typical. can be from different reasons. Viral infection is one of them. Pneumothorax is the air in between these two layers. Okay, so air accumulates and it pushes the lung to the other side. The lung collapses, and the cause of that, it could be something sharp that entered the chest wall. So air goes into the chest wall, or it could be a rib fracture that can cause that. And the person will have chest pain and shortness of breath. Pleural effusion, accumulation of fluid. Instead of air, you have fluid here. Also called hydrothorax. So this is pneumothorax is air, hydrothorax is fluid. And in this case, you have chest pain and shortness of breath. Again, same idea. You have to take an X-ray, and based on X-ray, you will know which one it is. It's very easy to diagnose. And empyema is pus in the pleural cavity, so this is also called pyothorax. Same symptoms as pleural effusion, but they usually have fever. They usually have a history of pneumonia, so they may have some more history. They may be sicker than the other ones. So when you get a person with a severe respiratory disease, not mild, severe, you have to do an arterial blood gas, not venous blood gas, because in veins the oxygen is low, carbon dioxide is already high, so you know what's going on. But you want to know in the arteries, you have to have higher oxygen and lower carbon dioxide. And if that's not the case, too much carbon dioxide, low oxygen, that's bad. So that will give you an idea about respiratory condition. If the person has pneumonia, again severe pneumonia, sputum culture and sensitivity can be an option. It's not the best option. The reason is that the mouth already is unclean, is full of bacteria, and when somebody is spitting, the sputum is already come in contact with mouth bacteria, so it's not very good, but it still can be used. The other option is that you can put a catheter. You can take a sample from the trachea or all the way in the bronchus. And sputum cytology, not commonly done. When this is done is for lung cancer. So if you see any abnormal cells, a person who has chest pain, somebody is older, and somebody has coughing blood, so that could be an early diagnostic tool. It's not the best diagnostic tool, but it could be one of them. Chest X-ray, very commonly done. So it's a 2D picture, black and white. Area that has a lot of air or maybe fluid, it looks dark. An area that is solid looks whiter. So the bones are looking whiter. This is liver, and this is the stomach, and this is the sternum, this is the heart, and this is the trachea. You can see that it's a little bit darker. So based on this, you can diagnose so many diseases, and it's very rapidly available, very cheap, easy to diagnose. Bronchography is that you are inhaling, and radiopaque agent, and airways looks whiter, and that way you will know if there is a blockage there, so part of it will not show up, and you say, oh yeah, there is a problem there. Then you can do some other tests based on that. So you want to see all the airways. If you cannot see somewhere, it means there is a disease there. Pulmonary angiography, this is for pulmonary embolism. So you put a catheter and inject the contrast, and you have to see all the blood vessels. If something is not there, for example, this blood vessel is blocked from here, you do not see this at all, it means there is a embolus there. So this is the gold standard diagnostic tool for pulmonary embolism, but right now you have CT scan, so that can be done. It's a little bit easier than this. This is very invasive. Other tests that you can do is oximetry, so you can check the level of oxygen. So normally it should be about 95 to 98%. If it is below 90%, you need to give oxygen to the patient. Pulmonary function test is this one. So if somebody has asthma, COPD, pneumonia, pneumoconiosis, some other diseases, then you do the pulmonary function test and the lung volumes and lung capacities, all of them, you know it. You can do this in a hospital or in a clinic. Very, very diagnostic. Spirometry is that you give this to the patient. So this is the spirometer, and the procedure is called the spirometry. Once the patient is under treatment for some respiratory diseases like asthma or COPD or pneumoconiosis, you want to see how is the patient doing, if the patient is improving or not. So then you can check some of the lung volumes based on that. The other one is called laryngoscopy, that is looking at the larynx, and bronchoscopy is looking at the bronchus. This is done by a surgeon or by an internist that they have enough training to do that. The catheter goes through the nose and to the pharynx, and then this goes to trachea, and it can goes to the bronchus, and if somebody has, for example, bleeding, so then you can see if that's because of cancer or something else. You can take pieces there for biopsy. If somebody has severe pneumonia, you can take a sample from for sputum for culture. And also it can be therapeutic. You can actually treat it too. Maybe it's a foreign body there, so you can remove it. So it can be diagnostic or it can be therapeutic. So some of the treatments that are there, one is called aerosol therapy, and this is the one that you can put a medication and suspend it in a mist, and the person can breathe better with that. So the amount of the drug that is taken this way or inhaled this way is better. Endotracheal intubation is that you're putting a tube into the airways. Okay. So for example, somebody goes into anesthesia, general anesthesia, you do that. Somebody has an airway problems, you can do that so the person can breathe. Nasal cannula is that you're putting some nasal cannula, and the person can breathe through that, so they delivers oxygen, and that you put the prongs near their nares, the nasal openings, and the person can breathe oxygen. Postural drainage is that you put the patient in a specific position, and you drain too much mucus. So for example, somebody has bronchiectasis or somebody has bronchitis, you do that, you drain the patient from too much of the mucus. And ventilator, I have the image here, so this is for people who cannot breathe by themselves. It's a mechanical ventilator, so until the person goes back to normal, or maybe somebody's in coma, you don't know, or during surgery, so they can use ventilator. So it's an artificial oxygen machine. Decongestant to release congestion, so somebody has too much of swelling in their nose from allergies, for example, they can give decongestant. Don't use it for too long because it can rebound and it can block your nose again. A bronchodilator, so that dilates the airways, and this can be used for patients like asthma. You can use it for patients with bronchitis, COPD. Antitussive is for coughing, so if somebody has a dry cough, you can use that. If somebody has a lot of mucus in it, you have to be careful, because if there is lots of mucus and you block the cough, then the mucus accumulates in the airways and the person can get pneumonia. So you can give, if somebody has a sputum, you can give expectorant, so that they can spit out the mucus or the phlegm. And For example, in patient with bronchitis, you can give this. And mucolytic is that lyses the mucus, but again, this is not very effective. Once you stop the medication, the effect goes away. So, not much recommended. There's some of them over the counter. I personally don't recommend it that much unless you have a lot of mucus and you're very congested. Pleurocentesis and thoracentesis, that you can put a syringe through the chest wall, and then if there's fluid there, you can remove the fluid. That can be for diagnostic purpose. And thoracostomy is that you can actually make a small incision in one of the intercostal spaces in the chest, and put the tube there, and you can put a catheter there. You can remove fluid, you can remove air, or you can go and take a biopsy. So this is a little bit more invasive. The thoracostomy is more invasive than the thoracentesis. And that's it. Okay.